So we need a picture like this, this, and
like,
this.
we gonna start like this, right?
Yeah.
And
Move. Angle, angle.
So we see her whole profile.
Looks great and beautiful.
Most sex education programs focus on giving kids information. So giving them information about contraceptives, giving them information about STIs. Our project also does that, but we decided that we wanted to think about sexuality in a more networked way. We wanted to think of sexuality as a system that has to do with emotional and social components.
But will you tell these fools I'm not crazy? Make them listen to me before it's too late!
So what Game Changer does is it invites youth to come to workshops where they create digital stories, they create video games, they create transmedia games that have to do with their experience of sexuality.
Game Changer grew out of a series of conversations about how some of the most intractable problems that youth experience, unintended pregnancy, sexually transmitted infections, were a product of more complex social situations.
And like in Chicago, you gotta be careful where you go.
We started talking about the unique ways in which games can break through lines of communication, can make joyful moments, and help people share ideas and communicate in ways they might not otherwise.
I'd like to begin with a fact. A simple yet shocking fact. It is this.
We're witnessing the secret of creation.
Fancy that.
So we ended up bringing a clinician and a professor of media studies together to start to work directly with youth to design games. One of the core components is that our team is very interdisciplinary, bringing backgrounds in clinical medicine, research, public health, along with digital media and game design, narrative, storytelling, theater.
And one of the reasons that we're dealing with games and digital stories is because that's what youth want to be doing. And it's a kind of indirect way to get them to the same material and also to give them better recall over the long term.
What's the story, Eddie?
The story is, you want to tell them the whole story?
Yeah, just do as much as you did. You always do a great job with that.
Okay.
You always have had
So,
a really good sense of what it is.
The main character is Zaria. She told her dad she was spending the night at her friend's house. And she didn't even go to her friend's house. She went to the party. She went there, you know, had fun. They was juking and stuff. Then a fight broke out. They started shooting, so her and this dude named Rico ran to the beach. And then it's a mystery game. We ain't gonna tell you too much, you know. Ain't gonna give you the whole recipe, just give you a little taste. She goes to the doctor and she gets a test, but she didn't get it the first time, she got it the second. I don't really know about all the psychic part. Doctor told her that the test results would be back in a week. So she went home, she had terrible headaches, so she started laying down, and then the game started in her dream.
Who came up with all that?
Me. It was my main idea. I made the story up and everything, you know, they just added parts to it. I gave some of them credit. The helping people.
You giving me credit?
Mm-mm.
Connected learning is really an old idea. It goes back to people like John Dewey. But what it says is that we learn all the time. We learn in school, we learn out of school, we learn from our peers. And what's so exciting for us in Game Changers to see these young people who come in and stay engaged throughout an entire day, intensively on project after project, but it's driven by things that they're interested in and driven by their stories.
No, I couldn't have put it all together, but
I think the fact that everybody in the room had some experiences, everybody kind of contributed. So there should be a little piece of everybody's story in Zaria's character. What did you contribute? Because you were really vocal in the beginning.
This story, yeah, it's kind of a lot like my life, except the rape part. But yeah, I do go with my dad's house over the weekend. Except my dad lives in the suburbs and my mom lives in the city.
So it's the reverse.
So it's the other way around.
Okay. So did you contribute that?
I don't know.
I don't remember if you contributed that or not. Okay, but it ended up in here.
Yeah.
Okay.
We envision our games as transmedia games, which tell a single story through photographs, videos, audio, comic book style pages, interactive video game sequences, real-world puzzles, and social media. Our format allows youth to engage in self-expression about emotional and sexual health. These are often tough topics to discuss for anyone, but youth are more willing to have these conversations when digital media are involved. They especially find narrative games familiar and exciting.
At the University of Chicago, we have a very unique opportunity because we're located on Chicago's South Side. The South Side of Chicago is home to some of the poorest communities in the state, actually in the country, and yet has amazing assets and an amazing history. The challenge for us is thinking, how can we bring all of the resources that we have at an institution and really make a rich experience for young people that can begin to help them meet some of the challenges that they face in their lives. Community violence, high rates of school dropout, high rates of sexually transmitted infections, unintended pregnancy, incarceration, drug abuse. But clearly the youth that participate in our projects are so much more. And what we want to do in Game Changer is show that their strength and their resilience comes from their experience, from being able to talk about it, narrate it, create stories. They have an incredible number of resources that they can bring to themselves and also to their community and to their peers.